Hey guys, Dr. Aruna Tummala from Trinergy Health. Today I'm going to talk about our practice, Trinergy Health in New Berlin, Wisconsin. This video is for anyone that is looking for a holistic approach to physical and mental wellness. So there are two aspects to our business. One is the psychiatry business as well, and the second one is the Ayurvedic Spa and Wellness Center. So I'm going to talk about the psychiatry clinic and what a new patient can expect when they come into us. So our whole philosophy at Trinergy is to provide a root cause resolution of symptoms. And the way we do that is by incorporating aspects of functional medicine as well as Ayurvedic medicine. So when you call us, our number is 262-955-6600. Our wonderful wellness coach, who is also trained in functional medicine, Helena Johnson, she is the person that you will most likely speak with. It could also be our amazing staff, office manager, Angie Jakovics. You could be speaking to either one of them, but it is Helena, who also is our wellness concierge. She will actually go through what it is you can expect when you work with us. So you'll receive a complimentary consultation with Helena, and based on our philosophy and our practice, if this is something that you're looking for, then you could sign up to work with me. The first consultation is going to be about 90 minutes long, and we will send you a lot of paperwork. I admit, I freely admit that we do send a lot of paperwork. The intention is to really understand everything about you, your childhood, your early life experiences, genetics, heredity, family history, everything about you we want to know. Because the reason why you are needing help today at this point in your life is actually the little seeds of this disease have been sown throughout your life. And we need to get to the absolute bottom of it. And so that's why please take your time to fill the forms that we send you. And then on the day of your appointment, actually the day before you come to see me, you will actually have a 30-minute video consultation with Dr. Sunita Pandey. She is our resident Ayurvedic physician. She's an MD in Ayurveda. So at Trinergy, we are offering a holistic psychiatric evaluation and integrative psychiatric evaluation. That's why you'll be seeing Dr. Sunita as well as me. I'm the psychiatrist. And Dr. Sunita will evaluate you using Ayurvedic principles, so she'll be able to understand your innate constitution, which is your prakriti, your innate dosha composition, and she'll also be able to evaluate what your imbalances are in terms of your doshas. And then the next day, you will see me, the psychiatrist, and be prepared for this interview. We are talking about very sensitive matters that are really affecting you at your core. So I typically recommend that people eat something. If your breakfast or lunch, make sure that you're not coming to this appointment on an empty stomach. Once you're here, we will offer you tea. It's herbal tea to make you feel at ease and comfortable. And then you and we're going to have a conversation about what led you into my practice. And after we figure that out, most often with the information that Dr. Sunita has already shared in your chart from her evaluation and from my own evaluation, we are usually able to understand what are the typical root causes of your presentation and how to fix it. And after that, whatever supplements that we recommend, they will be available for purchase. And if there are any other modalities that I'm recommending, we do use many different devices. We use a pulsed electromagnetic field mat. We use a cranial electrical stimulation device to help address symptoms of anxiety, depression, and insomnia. And then of course we use Ayurvedic body therapy. So we will, whatever is indicated for you, we will be recommending that. We will explain how that works, and then you'll have the opportunity of purchasing some of these supplements and some of the services that are recommended for you. Then within 5 to 7 days, of your initial appointment, you will receive a detailed visit summary from me. Now, this visit summary will go over what we found as your root causes. Now, remember, this is our the analysis is coming from our clinical evaluation. Obviously, there could be some blood work, lab tests, as well as genetic testing, and maybe sometimes urine and stool testing that we may recommend. It all depends on individual patient's presentation. But at baseline, we do recommend our baseline panel of blood work. And even though we are treating psychiatric illnesses, but remember, the root cause is actually in your body, in the various systems of the body. So it's important to rule out inflammation. It's important to rule out thyroid disease. It's important to rule out insulin dysmetabolism. It's important to rule out nutritional deficiencies and toxicity problems. So depending, based on our clinical evaluation, whatever indications we pick up on that, then we will be tailoring our blood work and our other laboratory evaluations based off of that. And we will provide you recommendations for this extended medical evaluation. And then there will also we also provide many different handouts. Most of these handouts I use them from the Institute of Functional Medicine. So you can be assured that the information that is being given to you has been studied and that it comes with amazing scientific backing and data. So our expectation is that you begin to implement the supplement regimen as well as the dietary recommendations that we make. Now, diet and lifestyle is foundational to the healing that we are able to create in our patients. But let's face it, if you have to give up some of your favorite foods, it's going to be difficult. Lifestyle change is the hardest thing that you'll be doing in our practice. Everything else is a piece of cake. We understand that it is difficult. So, and what we have found is that when you start with some of our supplements, with the detoxification that is happening, and the other important thing is your self-awareness. As you begin to understand how different things affect you personally, you will use that self-awareness to make meaningful changes in your life. But we also offer monthly coaching sessions. Helena, our wellness coach, she is trained in functional medicine as a coach, and we are offering monthly coaching sessions. And the idea behind this is not only to give you credible information that you can act upon, but the idea is that you will become a part of a cohort of members who are starting at the same time. All of you are brought together for a reason. You will be starting the lifestyle intervention at the same time. So other members in your coaching group will become your accountability partners as well as your support system. Because studies have shown that we do as our company does. Birds of same feathers flock together. We can use that to our advantage here. So we highly encourage people to participate in this coaching sessions, which run for 7 months. It's once a month and it runs for 7 months. And again, all of this is being offered to enhance your success at arriving or to enhance your success in this healing journey. And after you've taken the supplements for at least a week or two, then you will be in a better position to implement the dietary changes. And after that, I typically like to see patients back for a follow-up in 2 to 3 weeks' time. Because we send a lot of information in the visit summary, you will have a lot of questions, and the second visit is going to address that. And what I've learned in this field is that I first have to heal the body before I can address the problems in the mind. So psychotherapy comes later. But as soon as you implement some of these interventions to heal your body, you will begin to see changes within 2 to 3 weeks, which hopefully will give you the courage and the motivation and hope to stick to this program, even though it can get hard at times. And then typically in the second or third month, we will delve into psychotherapy, wherein all I'm teaching you is, number one, to develop self-awareness of your body as well as your own thoughts. And number 2, to understand what kinds of thinking patterns and thoughts are helpful for you and what is not. Separating the wheat from the chaff. And then to enhance your Laura, cut that out. So the hope is that with self-awareness and with recognizing what is helping for you and what is not, you will use that information to enhance your self-compassion, self-acceptance, self-love, and self-worth. This is all it is. Healing from psychiatric illnesses is not a mystery, you guys. This is all that is required. But the problem is that it's not going to happen overnight. There are going to be ups and downs. And it's not a marathon. It's not a sprint, it's a marathon. A typical duration for patients in my practice is 1 to 2 years. And don't be alarmed. It's not that you're going to feel miserable for 2 years and then and after 2 years, one day miraculously you're going to feel better. That's not what's going to happen. You are going to see consistent improvements in your physical and mental wellness. But the whole process of recovery really is about consistency of your new lifestyle change behaviors and the outcomes and the benefits that you're going to reap from that. So this is what you can expect at Trinergy Health. And if you're ready for this, give us a call. It's 262-955-6600. Take care.